Hello everyone, my name is Gaurav and today I want to start off by using our imaginations. I want you to imagine that you are having dinner with your family and out of nowhere one of your family members drops their fork. And then while you're looking at them, you start noticing some facial droop. Would you know what to do? Well, according to Maninder in a 2024 article titled Neuroscience Insights, it is very common for people to have disabilities after having strokes. So it is very important that we understand what a stroke is, how we can recognize signs of a stroke, and why a person needs to get transported to a stroke center as soon as possible. So firstly, there are two different types of strokes. There's an ischemic stroke or a hemorrhagic stroke. An ischemic stroke is when there is an occlusion within your vessels in your brain, causing there to be a lack of perfusion to the tissues. And then a hemorrhagic stroke is when there is a rupture in that artery, in that vein, and this causes there again to be a lack of blood flow or a lack of perfusion to those tissues. So Anna and Berson in a 2024 article reported that when a person has a stroke, 80% of the time it is likely to be a ischemic stroke rather than a hemorrhagic stroke. So, how can we recognize what a stroke is? So, there's a method called the GFAST method. And in this method, we take the G, and that is going to be the person's gaze. So when you look at someone, you want to see where they're looking. If they're not able to follow your fingers, then that is considered a G, that is considered the G in gaze. And then we have the F. F is facial droop. If a person presents with facial droop, you know that they're having a possible stroke. And then you have arm drift or unequal grips in their arms. And then you have your S, which is slurred speech. And finally, you have T for time, and time is very important. So when you recognize these signs, you know that this person could possibly be having a stroke and they need to get to a hospital as soon as possible. So why is it so important that we get this person to a hospital as soon as possible? Well, it is because of a medicine called TPA. As we discussed previously, most cases the person is having an ischemic stroke. So this means that they can be given the medicine TPA, which will bust that clot and allow there to be blood flow back into the brain. So there is a very small window that this medicine can be given. So it's very important that we get this person to the hospital as soon as possible so that there is a lack of disabilities later on in their life. So before we finish, I just want to go over everything again. A stroke is very common and it is mostly caused due to an ischemic attack, which is a lack of blood flow due to a blockage. And we can recognize these using the GFAST, and it is very important to get this person to the hospital as soon as possible. Thank you.